people know what they need to eat. People know that eating chips, cookies, French fries is not healthy. It's not lack of knowledge why people don't eat healthy. It's their mind. It's their mindset.
Hey everybody, it's Dr. V. Welcome back to another episode of Office Visits with Dr. V, where my whole goal is to help you be happy and healthy. And, we've gone through all the lifestyle pieces, but, really the reason I started this podcast is because I wanted a place for people to come where they can get reliable medical information from someone they trust. And so I am bringing you a guest today who she is called the Plant-Based MD. And she knows everything plant-based, but she's also an internal medicine physician. She practiced as a hospitalist. And so she's actually taking care of patients. And so we're going to be talking about today plant-based diets versus some of the weight loss drugs that we're hearing about that are so popular. Can we get the same effects from these weight loss drugs as we can from a plant-based diet? And two, what should we do? How exactly should we be approaching weight loss? So without further ado, I'm going to welcome, she goes by Dr. Judy. Welcome, Dr. Judy.
Hello, Dr. V. I'm so happy to be on your podcast. Hello, everyone listening.
Yes. I'm glad to have you here. First things first, we just want to give a little bio in your own words, really briefly. If they look you up on social media, they'll know you're a superstar, but you go ahead.
Sure thing. So to everyone listening, so I'm Dr. Judy. I am a board-certified internal medicine and lifestyle medicine physician. I've been in practice for about just over a decade, primarily in a hospital setting, but I've also done primary care. I also am a business owner and I have a lifestyle medicine company that at one time was providing lifestyle medicine consults for patients, as well as health coaching. And then we transitioned to providing group programs where we work with women to help them to transition to a healthy plant-based diet. They've been able to improve blood pressure, lose weight, and improve their diabetes. I also do speaking, and I also have a day job now where I kind of work remotely. So I do a lot of different things.
And we will definitely give your website and your contact info, because I can see people wanting you to come speak at their events, or also just, to touch base with you on the services that you offer. So first things first, for anybody who's new to the podcast, she mentioned lifestyle medicine. Both Dr. Judy and I are board certified in lifestyle medicine. And lifestyle medicine is simply a newer branch of medicine that uses your lifestyle to manage, treat, and prevent disease. So that is the definition. We do believe strongly in a whole food plant-based diet, but we do not say you cannot eat certain things. So Dr. Judy, before we get started, tell us exactly, what a plant-based diet is.
So that's a great question, because there are the terms vegan, vegetarian, plant-based that are thrown out, and people often ask, well, what's the difference? So I think of it as there's a plant-based diet, which is an umbrella, but you can have different dietary patterns under that. So a general definition of a plant-based diet is a diet that's predominantly plants, so fruits, vegetables, beans, whole grains, nuts, and seeds. And if you ask 10 people, they would have a different definition as far as what percentage of animal products can be included in a plant-based diet and still consider yourself plant-based. So that's why some people like the term plant-based, because it's a bit more flexible than the term vegan. I would say a vegan diet is a type of plant-based diet, but it's the most strictest, and it's also an ethical stance. So people become vegan because ethically they believe there's something morally wrong with killing animals for our human consumption and using them in human consumption in any form, whether it be using leather, eating honey, or even anything that uses an animal in the byproduct in the production of it, a vegan would not consume. So their main motivation is not for health. Whereas people that are plant-based, they're eliminating a majority of animal products primarily for health. And when I say animal products, that means anything that came from an animal. So meat, milk, dairy, cow's milk that's used to make cheese, yogurt, all of that is considered animal products. And so under plant-based, you have vegetarian, which there's different types of vegetarians as well. There's lacto-ovo-vegetarian. I always get them too confused. But lacto-ovo-vegetarian, I think they eat milk and eggs, whereas ovo-vegetarian eats eggs, if I have that correctly. So yeah, different types of vegetarianism. But people like to get caught up in labels sometimes and, oh, I'm vegetarian, I'm vegan. And I think the bigger picture is that we know that the diet in America is an unhealthy diet that tends to be heavy in processed foods, added sugars, and animal products. So any way that you can reduce those foods that are inflammatory is going to be beneficial for your health, rather than focusing on a label and thinking that, oh, I have to be vegan or I have to be fully plant-based is my approach.
Which, let me add the full name, whole food plant-based. So basically, I like to also add that whole food plant-based diet is looking at eliminating processed food. So if it was made in a factory somewhere, that's processed, and there are different levels of processing of food. But essentially, gosh, what's the guy's name? Michael, whatever.
Greger.
No, not Michael Greger.
Michael Pollan. Eat food, real food, mostly plant.
Mostly plant. And I like how he says, if your grandma wouldn't recognize it.
Yeah.
Then or your great grandma wouldn't recognize it, then it's probably over processed. It's probably highly processed. So, going back to your example of vegan, a vegan potentially might eat a plant-based meat like Beyond Meat or Impossible Meat, but that is also processed. So, it's made in a lab, and I've eaten it, and it is tasty, but again, it's processed. And one thing I like to discuss with people is that I love the word leaning. Like, we're leaning into this. When we got our certification, they say 95% plant-based. But, I'm 65, 75%. If we are improving our diet, if we're adding more vegetables, we're adding more whole grains, more fiber, which we are deficient in on the American diet, then we're winning. So leaning into it is also something that is, I think, should be applauded.
Yeah, I like that. And I've heard some people say plant-forward diet.
Yeah, I like that.
Yeah. And I'm glad you mentioned the whole food plant-based. Yeah, that's a type of plant-based diet. That's probably the more stricter one, I guess, compared to vegan. Yeah. How could I forget the whole food plant-based? That's the one that I advocate for, and we, as lifestyle medicine providers, go for.
Yeah. I think
whole food plant-based aims to cut out processed foods, right, added sugars. So yeah, there's variations.
Ooh, them added sugars. Well, look, let's talk about so highly processed foods increase our cravings, and they don't necessarily make us full. And so that's a good segue into these weight loss drugs. Currently, there's a lot of shine on Ozempic and Wegovy, which the generic name is semaglutide. Earlier, there was Mounjaro. Ozempic and Mounjaro are specifically, indicated for type 2 diabetics. Wegovy is for obesity and chronic. It's for chronic management of obesity. So it's helping you lose weight. And these drugs are very, very popular, especially now that you say you don't have to have type 2 diabetes. So the indication is if you are obese, which means you have a body mass index, BMI, above 30, and I believe 27 as well is included. So tell us, you've helped people lose weight with your holistic lifestyle medicine approach. And I know that, which I love about you, is that you say it's not one size fits all. So it's not all diet. Maybe you do need some medication. So just tell us generally how you approach weight loss with your patients.
Yeah, sure. And the BMI of 27 is if they have other chronic medical conditions.
Thank you.
So obesity is very complex, and I'm glad that there are drugs now in the market that are getting recognition to treat obesity, and we're recognizing it as a chronic medical problem. And the treatment of obesity has to be a multi-modal approach, so to speak. There's not one thing that's going to treat obesity for everybody. And I believe in having access to all of the tools in the toolbox and making an individualized approach to that particular person. But without a doubt, I think we all know and agree that a large portion of what's contributing to obesity is the food that people are putting in their mouth.
Right.
Now, why are they putting those foods in their mouth? Do they have increased appetite? Is it a hormonal issue? Are there genetic components that affect their hunger levels and their hormone levels? Do they have excess adipose tissue? So there are other reasons, and I really don't like that term that says eat, what does it say? Eat better, move more, or something like that. And I think it oversimplifies obesity and makes it seem like everybody that eats healthy and everybody that exercises will lose weight. But people that work with patients with weight know that there are some people that won't lose all the weight that they want to or need to by diet alone, and those people will need medication. And I believe that is okay. But I do think that sometimes we overfocus on medication, like we kind of want to skip the lifestyle part, and that's the problem. That's where my brand, the Plant-Based MD, comes in, because my whole thing is food first. We eat 3 times a day, so that should be the main first line of defense against chronic disease, the things that we're doing 3 times a day. A large portion of our society is focused around what we eat. If you think about it, when you go to a funeral, party, dinner, everything involves food. So until you address our thought patterns around food, I think there's a lot of mindset shifts that need to take place. Everything starts in the mind. So to target obesity, it's not just prescribing a drug. It's not even just saying eat plant-based. People need coaching to work on the mindset. Like, what are your triggers? When do you find yourself craving sugary foods? Is it when you're stressed? Is it particularly, when you had a long day at work? And helping you to reframe your thoughts around food instead of thinking this chocolate cookie will make me feel better, so let me eat it. Maybe reframe your thoughts and think, oh, okay, I can actually feel better by eating fruits and vegetables because I will have more energy and I won't have like that fatigue that you get after you eat. Do you know what I mean? Right. Yeah. So I think creating spaces where people can not feel shame for being overweight, because there is some fat shaming that occurs in the healthcare system. Patients often are very sensitive about their weight, and it's a very sensitive topic, and they do feel like they are fat shamed. So I think as providers, we definitely have to be empathetic about it. And that's where I would kind of start: empathy from the provider, and then from the individual, having a multi-specialty approach. They need a health coach, they need a physician who's knowledgeable and experienced in obesity medicine and lifestyle medicine. They need a nutritionist who can help them to eat healthier, and they also need to be in a community that is encouraging those healthy patterns. We know that it's easier to switch to and make better, healthier choices when you're around people that also support those habits. You know what I mean? Like, in a family, and there's a lot of peer pressure to eat unhealthy if you think about it. Like, you have to really be against the grain to eat whole food, plant-based. You think about when you go to a party, there's junk food. And what do they say? If you say, no, I'm going to have a salad, I'm going to not eat the fried chicken, I'm not going to eat the cake. They're like, come on, girl, it's a party. Yeah, it's just one piece. So you have to really internally be strong and really have a mindset to resist, because most of the forces I feel in society are geared to help you to eat unhealthy.
Oh, yes, especially in America. I will say we're taping this on a Sunday. My office is upstairs, and downstairs is Sunday dinner going on with my family. I have tried my best to introduce plants. They ain't having it. They're not having it. So community is important, I think, especially when you're just trying to reach any goal, when you're trying to make a change. I love the mindset piece. I love the mindset piece that you're referring to, because if you just stop and think, why am I eating the cookie? And get in touch with your feelings, then that can help reframe your eating. And so we really want to deal with the emotion and, put the cookie down if we can. If we can put the cookie down. You mentioned the multidisciplinary team that you might have to have for weight loss. And you mentioned obesity medicine. Now, I know there are probably some primary care doctors who are prescribing these medications, but obesity medicine, as you alluded to, obesity is a complex medical condition. So what would be the advantage of seeing someone who's actually certified in obesity medicine versus going to your primary care doctor?
Sure. So I'm internal medicine and I've done primary care. So I know what primary care entails. I've also done, just for your viewers, lifestyle medicine and did the certification. And I've started the training for the obesity medicine. So I've done like 2 of the courses. And the information that I learned in the obesity medicine courses was not covered in any of my internal medicine training, nor was it covered in the lifestyle medicine training. So I know for sure that you will get an added level of expertise that you may not be getting from your primary doctor. So I would just say, if your primary doctor is experienced in obesity, they are attending conferences or doing like the CMEs on it, there's information that they can learn on their own. They don't necessarily have to have the full obesity certification, but definitely having that awareness to the fact that obesity is a chronic disease, which I think previously we didn't really think of it as a chronic disease. We kind of really thought of it as people are overweight because they eat too much and they don't exercise. Whereas now, we're really acknowledging that there's different reasons that play a role in excess weight, physiologic reasons why some people really do struggle with losing weight. So that's why I think the individual has to take ownership and seek out providers that are going to be, I would say, experienced and comfortable with treating obesity, I would say.
Yeah.
And I found when I was doing primary care too, that people were very sensitive about their weight. If I touched on their weight, almost like they were offended, like, you know what I mean? So I had to really kind of tiptoe around it, so to speak. So I'm sure that it's not really addressed oftentimes in clinic visits, I don't think.
Yeah. The annual well woman visit for me, so as an OBGYN, that is something that I try to touch on, especially if we can see a big trend. Like last year, you weighed X and you have gained 10, 15 pounds. Like we can't do that every single year, and trying to get to the root of what's going on. There are some gynecologic conditions that contribute that are because of obesity, like heavy, painful periods. If you lose like 10% of your body weight, your periods will get lighter because of the hormone estrogen. PCOS, that's another one. Oh my gosh, women are trying to lose weight. They're doing everything I've said. And it's the insulin resistance that is kind of working against them. So, I think that we as clinicians need to understand how obesity contributes to disease, but also understand, the factors that go into obesity. I was just doing a CME and learning about obesity. I was surprised to know that the adipose tissue, they like secrete these markers, or I don't know if they're hormones, but the actual fat is not just sitting there, like it's sending signals back to the body. And so I think that's why these medications for some are going to be helpful, because if you got a lot of adipose, it is actually working against you. So briefly, from what I know about these medications, the side effects, I'm sorry, not the side effects, but the way it works is it helps, produce insulin. It also delays the emptying of your stomach. So you feel, you don't feel hungry. So it decreases your appetite. It can also reduce your craving. So, do you have anything to add about the weight loss drugs and maybe kind of some of the things you've seen?
Yeah, some people will continue to have cravings because of the physiologic factors as far as adipose tissue releasing hormones and cytokines. But that's the nice thing about these drugs is that they can help suppress your appetite. And some people on a whole food plant-based diet will not feel full. They will not feel satisfied after they eat. And you can tell them to eat more fat, more protein, more healthy fats, more protein to help them to stay full longer, and they will still feel hungry, still have those cravings. So that's one way that those drugs do help those patients to not feel hungry all the time.
Okay. So the medications are effective. They do help people lose weight. On a plant-based diet, though, how can we reduce our cravings and how can we feel fuller?
By eating more protein and more fat, healthy fat. So avocados, nuts, and seeds are good sources of healthy fat. I know that there's some conversation around a whole food plant-based diet that is extremely low fat, but I find a lot of people feel hungry when they're limiting fat to that degree. So I don't recommend no fat. And actually, for someone who's trying to lose weight, eating fat can help you to feel full so that you're not feeling as hungry.
Right. Right.
So you need fat and you need protein.
And what about fiber?
Yeah, fiber helps you to feel full as well. So, at least 20 to 40 grams a day of fiber. That helps to keep your GI tract moving, helps to keep you regular. Fiber is really important as well.
And I will just give a plug. I have taken Dr. Judy's course. She goes through a plant-based diet and talks to you about the proteins and carbohydrates and educates you on a deeper level. So we're going to pause right there. You're going to tell us how they can get that information at the end. One thing that I think helps also to reduce your cravings is getting rid of all of the refined sugars in your diet. Because I just feel like, for lack of a better word, it's like crack. Sugar can be like crack. And it's like the more you eat, the more you want. And so usually that's in the processed form. And so trying to reduce that is really good. But your taste buds, they've got to make that adjustment because it can be hard to get rid of sugar. You have any tips on how to get rid of sugar out of your diet?
So one of my favorite books on creating new habits, Atomic Habits, is really good. And in my course, I talked a lot about principles from that book as well as mindset because people know what they need to eat. People know that eating chips, cookies, French fries is not healthy. It's not lack of knowledge why people don't eat healthy. It's their mind. It's their mindset. So that's why the first place that we have to go is go deeper than the surface and find out, is there, for example, childhood trauma, other traumatic adulthood experiences that that person has had whereby they self-soothe by eating food. So there's so much beneath the surface that we're really not touching on. We're not touching on it when we just prescribe someone a weight loss drug. We're not touching on it when we just talk about weight in the clinic, but we don't really address their mind. People that are overweight see themselves as overweight, like people that have been overweight their whole life. And so they have to start seeing themselves as not being overweight before they can even begin to believe that it's possible to lose weight. Otherwise, they will continue to see themselves as being overweight. They will continue to engage in behaviors that people that are overweight more likely will engage in, if you know what I mean, like eating certain things or maybe not exercising. So it takes a lot of mindset work, changing your mind about what you believe about yourself, your relationship with food, mindful eating. So I spent a lot of time and years giving people information, but as a result of the course that I had last year, I realized people have information. I gave them all the information. Like the mindset piece was really what they needed more on. So I started to focus more on that, with the second time that I did the course, because they were like, Dr. Judy, I know I shouldn't have eaten these chips, but I did it. And I was just like, and they were feeling so bad and so guilty. So that's, the most important thing, I would say, the mindset piece, mindful eating. Like, we are so busy in society that we don't even pay attention to our thoughts and our feelings. So we just eat instead of thinking, okay, how do I feel right now? Okay, when you're craving something like French fries, how do I feel? Like, do I feel happy? Do I feel sad? Am I a little bit anxious about something? Am I feeling stressed and I want to feel better with food? Because like you say, sugar, fat, and salt is like crack. It's literally addictive. And the companies that make the food know this. They usually put sugar in so many foods that do not need sugar in it. And it's geared to keep you hooked.
Yep.
So you have to literally fight the system to eat healthier in America. And the food in Europe, for example, and other countries is different than America. There's different regulations of what they allow in America. Even ketchup, ketchup in the UK is different than America. In America, it has high fructose corn syrup. In UK, they have regulations around the use of high fructose corn syrup. So I think it has sugar or something like that. But I've lived in the UK. I was over there for a month before and visited a lot of times. And it tastes different. The ketchup doesn't taste as sweet over there as it does here. Even in Africa, when I went to Tanzania and Kenya, even there, the ketchup doesn't taste nearly as sweet as it does in America. So people really have to kind of be more mindful about what they're eating and change their beliefs around what is normal. And just because something's normal doesn't mean that we should be doing it.
Right.
Like, it's normal to eat meat with your meal. We think a plate of food is inadequate if it doesn't have meat in it. But that's really actually not the way it should be.
Right. And you talked about other countries. Their meat is their side, where ours is our entree. So
right.
They're not as sick as us. So ladies and gentlemen, if you detect an accent, she does have a little bit of an accent. So she's from Bermuda. So she's from Bermuda. She's not from America. So, and if you go on her Instagram, her mom still lives there, and they have mango trees, and they're just like eating all of this healthy stuff. Tell us, from an outside perspective, kind of what you just did. Like, how was it different for you growing up in Bermuda as opposed to America?
Well, unfortunately, Bermuda has now become a lot like America. The obesity, it's become very much like America, unfortunately, with fast food and obesity rates just skyrocketing. But growing up, the culture was not centered around fast food. It was centered around cooked meals at home and more fruits and vegetables. And then also I grew up in and I'm still a part of the Seventh-day Adventist faith community, which encourages a vegetarian and plant-based lifestyle. So we never grew up eating red meat, shrimp. In my household, we ate white meat a few times a week. We ate a good bit of cheese, milk, and eggs, though, however. But I do think that Caribbean cultures tend to be more Caribbean cultures tend to embrace more of a holistic lifestyle a little bit more, as far as like herbs, natural remedies.
Right.
But the U.S., nowadays, people are looking more for natural remedies more than they did maybe 10 years ago. People are searching for natural ways to treat disease.
Yeah.
So people are interested in this information. They're hungry for it. So they're seeing naturopathic doctors. They're seeing chiropractors who are more holistic. So that's why, I'm so glad that there are more physicians that are getting certified in lifestyle medicine. Yeah. And really my view is that lifestyle medicine is the way that medicine should be practiced. It should not need to be a separate specialty. Like, medical students and residents should be learning the importance of nutrition, exercise, sleep, stress reduction, social connections, and avoiding risky substances. They should be learning that these things are powerful instead of it just being like, oh, tell your patient to eat healthier, and they may do it, they may not, but at the end of the day, you prescribe a medication.
Oh, give us some studies, right? And what's school? Give us the tea. She just listed the pillars of health from lifestyle medicine: nutrition, physical activity, stress reduction, sleep, so healthy relationships, and reducing risky substances. I like to throw the last one in there. This is my plus one, purpose, fulfillment, because I think that helps to contribute to a well-rounded life. Lastly, I will say, because we're kind of focusing on these weight loss drugs and I have a friend who's actually on it, and she first started it, and she really wasn't losing any weight. And, she's paying $100 per injection because they can't find the medication or whatever. I don't know, but $100 per injection. It wasn't until she added the lifestyle piece that she did seem to get some benefit. So I would just say, I think that you're going to have to do the lifestyle piece anyway. You were talking about how it should just be the way we practice medicine. Like they teach us, okay, somebody has high blood pressure, diabetes, or high cholesterol. You tell them, I'm going to give you 3 months to change your lifestyle. We don't give them any information, no plan, maybe a nutrition referral, maybe. I don't see most people doing that. But, it's kind of like, all right, it almost feels like we don't want them to win, because if you really want me to lose weight, then you would support me. I mean, if you really want me to change my lifestyle to treat these diseases, you would support me. So,
and health coaches really need to be a part of primary care. I'm sure I probably have some motivational interviewing training to figure out how to get people to change their behaviors. But a health coach really can hone in on what I've spoken about previously as far as the mindset, the feelings, the beliefs that they're having.
Yeah.
And coaching is essential. And so for the viewers, you cannot just go to your primary care doctor and expect to get everything. You cannot. Maybe if you're going to a DPC where the visits are longer, but in a 15-minute visit, you're barely scratching the surface. That's enough time to get your prescription refill, make sure your blood pressure is not too high, get some blood work, but you're not going to be getting below the surface on your belief patterns, your thoughts, your connection, your relationship to food, and what you associate food with. And I think a lot of people are dealing with food addictions, and they're self-soothing with food to make themselves feel better, either because emotionally something is, I don't want to say off, but they're dealing with things emotionally and mentally that they're not able to talk about.
Wow. Woo! So, y'all, if we don't take anything from it, mindset. That especially if you're overeating, you're emotionally eating, there is something below the surface that is driving you to do that. So, you mentioned DPC, direct primary care. Tell our listeners a little bit about what that is, because they might want to seek out a DPC doctor.
I love the DPC primary care model. Direct primary care takes out the middleman, which is the insurance company. It's cash-based. The visits tend to be longer. The physicians take on a smaller panel of patients. I'm not going to say the number, how many patients you have in a regular practice, but it's
thousands.
It's not good. It's a lot. Yeah. So DPC typically will have a much smaller patient panel than that. You have more access to your doctor. Oftentimes, you may either have the phone number and access to email them. So it's definitely a lot more access, a lot more personalized, intimate care. And the visits are longer, usually like 30 minutes to an hour, most people have. Definitely something to look into. If you're someone that has a lot of chronic medical problems and you're tired of having to go back to the doctor for a 15-minute visit every 3 months or every month, you go to one DPC visit, it's 30 minutes or whatever that clinic has their visit set up as, and you can address the problem in one visit instead of having to come back. That was one thing I didn't like about primary care. I felt the visits were too short and they had to come back and start the story again. Yeah, it was very disjointed.
Yeah, absolutely. I completely agree. So, gosh, I hope we've exposed people, taught people about obesity medicine, direct primary care. I love that, obesity is multifaceted. It's not just eat less, move more. There are lots of tools that you can use, but I think what you have really kind of, set home is that, the patient is really, there's definitely a role for the patient in this process. It's not just the medications that you can give. It's seeking out the right providers that can help you, the right a team of folks to help you with weight loss. And look, as a perimenopausal woman myself, trying to lose weight, I'm just telling y'all, it is a process, and you do need support. So, Dr. Judy, any last words, any last nuggets you want to leave with the listeners?
Sure. So what I want to leave with the listeners is making healthier lifestyle changes. It's not easy. We acknowledge that. It takes time. So give yourself grace. And I like to use a method where you pick one thing and work on that for 21 days. So like let's say you're drinking soda every day. So instead of drinking soda every day, say, I'm only going to drink soda on Monday or only on Wednesday or something like that. But it has to be a specific amount that you're going to cut it back by, and you're going to do it for like a week or two. But you get to choose. But you have to be in the driver's seat. And what I really want to empower people to do is to start seeing themselves as, I would say, as God would have us, as God sees us, as beings that are capable, that are energetic, that are vibrant, that are really living our best life. And I think it starts there. If you start seeing yourself in a different way, instead of seeing yourself as this overweight, sick person who everybody in your family has diabetes, so you're going to get it, like that mindset has to change first. So seeking a health coach, a holistic minded physician, lifestyle medicine physician. And if you're a believer, praying and asking God to help you and give you the willpower.
Amen. Lord have mercy. Because why can you do it?
Okay. He can work miracles. Okay. He can part the Red Sea. He can save Daniel in the lion's den. He can help you overcome food addictions.
Absolutely. Absolutely. And I think what you have highlighted also is that the system is really wired to keep you hooked to the system, to keep you paying.
Absolutely.
And so I don't know. For me, once I know that somebody is subtly trying to get me to do something, I feel like it's an attack, like, and it gives me energy to like want to fight back. So
yeah, we can fight back with our food choices. Absolutely, especially for people of color who often are marginalized by the healthcare system. There's healthcare racism, medical racism, and healthcare disparities.
Yes.
We often don't want to go to the doctor, rightfully so. But by eating more of a whole food plant-based diet, you take back some of that ownership, and you're basically fighting back against a system that in some ways, I don't want to say wants you to fail. That sounds negative, but that's how I feel. I feel like the system wants people of color to fail.
Okay, I need to wrap it up here, but yeah, it's sick care, not health care. Like if people are healthy and well, then the dollars are lower. So
yeah,
I hate to say that too, because we both are in.
I hate it.
Yeah, but honestly, I just feel like if we really wanted people to change their lifestyle and get off of medication and not need surgery, then there would be certain things that we would be taught in medical school, certain systems that would be in place. Health coaches would be in every clinic, nutritionists would be in every clinic, but that's not how the system is set up. But topic for another day. Dr. Judy Brangman, how can we get in touch with you, work with you, see you?
Sure. So you can reach out to me. I am on all platforms at The Plant-Based MD, Facebook, Instagram, and my website is theplantbasedmd.com. I have my current services there. You can put in your email in my website, and I'll send you my free guide, 7 Biblical Reasons to Eat Healthy. And I also recently started a YouTube channel, so you can find me on YouTube too. I have videos on there, and I have a video with you on there, actually. So check that out.
Yeah, we talked about GYN issues. Yeah. And I know that there are some medical folks that do listen. So you do have a lifestyle medicine entrepreneur program as well. Is that correct? And your course,
yes.
Nutrition.
Yeah. So I have my course, Plant-Based Eating 101. Planning to relaunch that, and it's going to be slightly different, but it will incorporate more faith and purpose into it, spirituality. And I recently started coaching doctors on launching lifestyle medicine businesses, because the more of us that are doing this, like how you have your own business, I have mine, the more people that we can reach in ways that the traditional clinic visit cannot reach, right? There are some people that will never want to really go into a clinic. They don't like seeking healthcare, but if we make it accessible to them by creating online courses, programs, doing telemedicine, virtual visits, more people can have access to care. So I am a marketing and social media expert. I love it. I'm passionate about it. So I want to help more doctors get the message out, get the offer out, make money, and change lives.
Absolutely. And I'll just put in this aside. When I was starting, before I left my job, I reached out to you. Y'all, she was so gracious. She didn't know me from Adam, but definitely if you're looking for a mentor or for someone who just really cares passionately about you being your best, then you definitely want to look up Dr. and Judy. And, I thank you for answering the call. You are definitely walking in your purpose. You are changing lives, not just for patients, but for other physicians. And it can be scary to step outside of the traditional system that we've been trained in. And so I thank you for all of the work that you're doing to help get us out there and put a foot in our behind and get us going.
Thank you. And I'm so grateful for our friendship that has developed over the few years since you first reached out. I love that you're in North Carolina. And yeah.
Yes. We're in the same state. So, ladies and gentlemen, I hope you all enjoyed this episode. If you want to learn more, you can definitely go to my site where I have some resources. But listen, just Google some of the topics that we talked about. Find a direct primary care doctor. Let's get started on this journey. So until next time, I hope you will be happier and healthier. Bye-bye.